Hi, my name is Isa Risk. I'm a college professor and I teach electronics, and I have a hobby. My hobby is playing the drum. And I injured my wrist a while ago, so I went to see a doctor, actually specialist, and they told me I need an X-ray and an MRI. And I did both, and both did not reveal anything. So after which the doctor suggested that they would remove one or a couple bones from my wrist, and that should give me some kind of relief, and then the pain should disappear. I did not go through that idea or that plan, and I continued suffering with my wrist. That also ended interfering with my hobby. Anytime I would do a power hand shake, I would suffer for a couple of days, 3 days, a week sometimes. The only relief that I will get is when I somehow find the best location for my wrist, or that's how I get comfortable. And finally I decided to discuss this with Dr. Amer, and I came here, and only after 2 sessions I am able right now to use my wrist the way I used to, and I am able to play the drum the way I used to without any pain anymore. And
now, Professor, how long have you had this? Have you had
this has been going on for 3 years, 3.5, 4 years. 4 years actually. This has been going on for 4 years.
4 years.
4 years.
And actually, what we did when we examined him, his pain actually was right in the there's 2 bones here. It's called a scaphoid and a lunate. I'm going to actually show it right here. This bone right here. And these 2 bones actually are tethered together with a tiny ligament, about 1 millimeter thickness. It's called the scapholunate ligament. And it was definitely a subluxation. It was definitely stiff. We mobilized that. When he mentioned that he had the issue for 4 years, I'm starting thinking maybe low blood supply that's not showcasing an X-ray or an MRI. It wasn't sensitive enough. The proximal end of the scaphoid, which is right here, it has low blood supply to it. The radial artery actually supplies the distal end of it. So sometimes you could fear to have, you maybe have an underlying avascular necrosis because of the blood supply, since the pain and symptoms was more on the proximal end of the scaphoid and the lunate. We removed the subluxation by mobilizing the wrist. We also injected about 700 joules of laser energy at a synchronized wavelength of 805, 808 and 905. And that actually helped the pain significantly, decreased the pain and the inflammation. But it wasn't until we used the electromagnetic field therapy that actually, when we stacked that with the laser, his energy came back. He was able to be more productive, and his weakness seems to be significantly improved. And this is within literally, a few treatments, 2 treatments. The electromagnetic field therapy, which I'm actually going to post a picture of that, after the video. Every cell in our body has electrical charge. Much like if you have energy, you're able to get along with your day. If you're feeling tired, you're kind of like lollygagging around. Same thing with your cells. If you lose that electric charge on their cells are basically weak. You're unable to, undergo your inflammation. Healing process becomes compromised. They have a reduced electrical charge. So the electromagnetic field therapy, you can recharge the cells. We put on a frequency of 807 hertz, along with the laser therapy. It did the trick. It was actually quite amazing. I didn't expect for him to heal that quickly, and I'm definitely not going to say he's healed, but to reduce the pain that fast. And much like the old video of the guy who can throw a football for 13 years, I think we're going to have him, play his hobby right now. I think you guys will, will love it. So, show us along, man.
There you go. right now. I feel much better, and that's why I'm able to play the drum the way I used to. I feel great. Thank you, Dr. Amer.